Hello, this is Dr. Gray and it's time for updates. June 2025. Are seed oils good for your heart and metabolic health? And the answer is, according to the presentation at Nutrition 2025, that the seed oils like sunflower oil, soya bean oil, and corn oil, these all are quite good for your heart and metabolic health, contrary to the recent critics that have been saying that these oils cause inflammation and therefore they are not good for the health. Second one is restless leg syndrome in CKD patient is strongly associated with iron deficiency. So restless leg syndrome, a creepy crawly sensation usually at night, which causes patients to wake up and it deters the patient from sleeping. So we already know that restless leg syndrome is most often associated with iron deficiency, but especially if the person is having chronic kidney disease, then the likelihood is more. Single dose of psilocybin can reduce anxiety and depression in cancer patients. And this is a very fascinating study, because if we get such a treatment, we all know that cancer patients are in so much anxiety and apprehension and depression. And if we can get a method to help them, it will be a very good thing for us. At least we can lend a little bit support. Atopic dermatitis is linked to short stature in young children. So atopic dermatitis is actually allergic skin disease. So the next one is very relevant to Indian scenario, and the study is a person who is having rheumatoid arthritis is very much susceptible, whether on treatment or not on treatment, to pulmonary tuberculosis. So we also need to have high index of suspicion for tuberculosis in the rheumatoid arthritis patient, vice versa. Anti-diabetic drug Tirzepatide has beneficial effect in Alzheimer's and dementia. So this needs more studies, more proper studies to confirm its benefits. Let's move on to the next. Scientists have come up with a new biomarker that can tell you whether the cancer will respond to the particular chemotherapy or not. And this is quite practical and quite useful biomarker. High systemic immune inflammation index in early pregnancy is linked to more cases of pre-eclampsia, more chance of pre-eclampsia. And I think gynecologists will agree with me that this index might be very useful here, because it's very easy to calculate it: platelets multiplied by neutrophils divided by lymphocytes. So yes, that can be taken up in the clinics also.